Berberine. 7 health benefits of berberine you should know about. Berberine, or berberine hydrochloride, is a yellow compound found in the roots, rhizomes, and stem barks of many plant species, including goldthread, Oregon grape, and barberry. Berberine is a natural supplement said to have health benefits, from lowering blood sugar to helping weight loss. It is one of the few supplements shown to be as effective as a pharmaceutical drug. One of the main actions of berberine is to activate an enzyme inside cells called AMP-activated protein kinase, AMPK. This enzyme is sometimes referred to as a metabolic master switch. It is found in the cells of various organs, including the brain, muscle, kidney, heart, and liver. This enzyme plays a major role in regulating metabolism. Here's everything you need to know about berberine and its potential health benefits. 1. Lower blood sugar. 1 in 10 people in the United States has diabetes, 90 to 95% of whom have type 2. Recent studies on the potential health effects of berberine have caught the attention of healthcare professionals and people looking for natural ways to treat diabetes. In a 2018 OncoTarget review, researchers found berberine could be an effective treatment for people with type 2 diabetes. Its blood sugar-lowering effects, they wrote, were comparable to metformin, a common drug prescribed to regulate high blood sugar. It seems to work via multiple different mechanisms. Decreases insulin resistance, making the blood sugar-lowering hormone insulin more effective. Increases glycolysis, helping the body break down sugars inside cells. Decrease sugar production in the liver. Slows the breakdown of carbohydrates in the gut. Increases the number of beneficial bacteria in the gut. More research is needed, but the researchers say a combination of berberine and metformin might allow a reduction in the dosage of each drug and have fewer side effects from using one or the other drug. Before you try berberine, you'll need to talk to your doctor, especially if you take insulin. 2. Lose weight. Berberine may also be effective as a weight loss supplement. One review reported that people who took 750 milligrams of barberry twice a day for 3 months had a significant decrease in weight. Barberry is a plant that contains high amounts of berberine. Also, a double-blind study found that individuals with metabolic syndrome who took 200 milligrams of barberry 3 times a day experienced decreases in their body mass index readings. The team behind another study observed that berberine may activate brown adipose tissue. This tissue helps the body turn food into body heat, and increased activation may help treat obesity and metabolic syndrome. Berberine also appears to inhibit the growth of fat cells at the molecular level. 3. Lower cholesterol. Heart disease is the leading cause of death in the United States, and high cholesterol is a major culprit. When fatty deposits build up from high cholesterol, they can cause clogged arteries and impede blood flow to the heart and body. Lowering cholesterol assists in fighting heart disease. Studies have shown that berberine can help reduce cholesterol levels in some individuals. In a study in Phytomedicine, obese participants were given 500 milligrams of berberine 3 times a day for 12 weeks. The results revealed a reduction in blood lipid levels and mild weight loss. This is just one study, of course. Researchers will need to conduct more human studies to determine whether the supplement can really lower cholesterol. But it's a promising sign that berberine may help you keep your ticker healthy. For people who don't tolerate statins, the most common type of drug for treating high cholesterol, berberine may be a safe alternative to consider. 4. Prevent recurring UTIs and cystitis. Berberine might help women avoid the pain and burning of recurring urinary tract infections, UTIs, and bladder inflammation known as cystitis. In a 2018 randomized controlled trial, published in the Journal of Chemotherapy, a combination of different plant extracts, including berberine, was used to evaluate the effectiveness in preventing the recurrence of UTIs. Group A received berberine, arbutin, and birch. Meanwhile, Group B got berberine, arbutin, birch, and forskolin. Group C received proanthocyanidins, plant compounds that researchers believe are responsible for cranberry juice's ability to treat UTIs. Participants in the groups A and B had a lower number of recurrent cystitis during treatment and follow-up, with a lower median bacterial load than the group C. 5. Find digestive relief. The anti-inflammatory and antimicrobial aspects of berberine may support the gut microbiome of people with gastrointestinal ailments, diarrhea, and bacterial overgrowth due to irritable bowel syndrome, ulcerative colitis, and other inflammatory bowel diseases. In a randomized, placebo-controlled study published in Phytotherapy Research, patients with diarrhea-predominant irritable bowel syndrome took 400 mg of berberine a day for 8 weeks, resulting in improvements in diarrhea frequency and urgency, and abdominal pain. 6. May help prevent certain cancers. Berberine can create changes within the molecules of cells, and this could have another potential benefit: fighting cancer. One review found that berberine has clear inhibitory effects on the following cancers: colorectal cancer, lung cancer, ovarian cancer, prostate cancer, liver cancer, cervical cancer. Another study states that berberine helps treat cancer by interfering with its progression and its typical life cycle. It may also play a role in killing cancer cells. Based on this evidence, the authors state, berberine is highly expected to be effective, safe, and affordable as a cancer-fighting agent. However, it is important to remember that researchers have only studied berberine's effects on cancer cells in a laboratory, not in people. 7. Polycystic ovary syndrome. Polycystic ovary syndrome (POS) occurs when a female has high levels of certain male hormones. The syndrome is a hormonal and metabolic imbalance that can lead to infertility and other health issues. POS is linked with many issues that berberine may help address. For example, a person with POS may also have high levels of insulin, diabetes, or both, high blood pressure, high cholesterol, more body weight. Doctors sometimes prescribe Metformin, a diabetes drug, to treat POS. As berberine appears to have similar effects to Metformin, it may also be a good treatment option for POS. A systematic review found that berberine has promise as a treatment for POS with insulin resistance. However, the authors state that confirming these effects will require further studies. 8. Berberine versus Metformin. Scientists say that berberine and Metformin share many features, and both could be useful for treating type 2 diabetes. However, if a person's doctor has prescribed Metformin, they should not consider berberine as an alternative without first discussing it with their doctor. A doctor will prescribe the correct amount of Metformin for an individual, based on clinical research. It is not possible to know how a supplement will match that amount. Berberine can interact with Metformin and affect blood sugar levels, making them harder to manage. In one study, taking berberine and Metformin together led to a 25% drop in the impact of Metformin. One day, berberine may become a suitable alternative to Metformin for managing blood sugar levels, but more research is necessary. 9. How do people use berberine? Berberine is available as an extract and in powder or capsule form. Many of the studies cited in the review used dosages in the range of 900 to 1,500 mg per day. It is common to take 500 mg 3 times per day, before meals, a total of 1,500 mg per day. Berberine has a half-life of several hours, so it is necessary to spread your dosage to several times per day to achieve stable blood levels. Since supplements aren't reviewed by the Food and Drug Administration, FDA, third-party certification is one way to ensure safety. 10. Risks or side effects. As with any supplement or medication, some side effects might occur. Studies note berberine is generally well tolerated. However, some people may experience headaches, skin irritation, nausea, cramping, vomiting, diarrhea, constipation, or a slow heart rate if berberine is taken in high doses. Here are some possible risks, according to the NCCIH, National Center for Complementary and Integrative Health. Berberine may interfere with other medications, such as Metformin. It is not always clear how much of an active ingredient is present in a supplement, which could lead to taking the wrong dose. Adverse effects can occur if people take too much or if a person is susceptible. There is not enough scientific information to prove that Golden Seal and other berberine products are safe for long-term use. Taking berberine during pregnancy or while breastfeeding could have a negative impact on the fetus or newborn. People should speak with their doctor before taking products containing berberine. 11. Summary. Research suggests that berberine could be a promising treatment for several conditions, including diabetes, heart disease, and obesity. If you want to try a berberine supplement, then there is a good selection of high-quality supplements available on Amazon. The people who stand to benefit the most are individuals with type 2 diabetes and metabolic syndrome. However, it may also be useful as general protection against chronic disease, as well as an anti-aging supplement. Berberine is one of the very few supplements that are as effective as a drug. As such, people should use it with care and speak with a doctor before taking it. If this video is helping you, share this video on your SNS. Sharing is caring.
Thank you for watching. Please tap to subscribe to our channel. See you.